Okay, good morning, everyone. This morning we are going to get a walkthrough and take some testimony on H-120, which is an act relating to the study and design of a long-term care trust fund. And at this point in time, what we're going to do is have a walkthrough of the bill from Ledge Counsel. And then we are going to hear from the bill's sponsor, Representative Iacoboni. Commissioner, Treasurer Pichek is not going to be able to come this morning. He is going to come hopefully on Thursday. And then after that, we're going to take up our final testimony on H-248, the Child Care Financial Assistance Program. So good morning, Katie.
Thank you. Good morning. Katie McGlynn, Office of Legislative Counsel. Let me share my screen. Okay. So we're looking at H-120 this morning. And as you said, this doesn't create a trust fund, but it asks the Secretary of the Administration to come up with a plan, report back on what a trust fund for long-term care might look like. So to look at the language in subsection A, as I said, the Secretary of Administration is to study and design a trust fund that would provide long-term care for eligible persons. In particular, the Secretary shall study the following. So this is what you're going to ask for more information on and hear back on. The creation and design of the trust fund based on a social insurance model, such as Social Security. A funding plan addressing the collection of funds starting on July 1, 2026, for a minimum of 3 years before benefits would be provided. The collection of funds from residents of Vermont who have a Vermont taxable income of over 150% FPL. The creation of a governing committee and a recommended composition of this committee that would administer the fund, develop the benefit package and eligibility thresholds based on capacity to carry out activities of daily living and cognitive challenges, and develop regulations regarding the portability of benefits for persons who pay into the system and then leave Vermont. This plan will also look at the viability of persons being eligible for benefits after paying into the program for at least 2 years, and the transfer of fund resources to Medicaid to be used in providing long-term care services. The Secretary may receive assistance from any agency, department, division, or office, and any board or commission of any such entity, or any independent board or commission in the executive branch of the state. And you would get this information back by next January. The Secretary shall submit a written report on its findings to the policy committees, and the report shall include any necessary proposed legislation to implement the creation of the fund. This takes effect July 1, 2025.
So essentially what it's doing is asking for a report about how such a fund would be created. And it seems like it makes some assumptions, although it doesn't actually say it, that it would be some sort of payroll type contribution or tax from individuals. Is that?
It doesn't specify the source, but I think that's sort of what you're asking for information on. How would this be funded?
Right. Okay, so the collection of funds from residents. Okay, so it says collection. It doesn't
Like
necessarily.
Social Security, though, on a social insurance model like Social Security.
Right, so that means like a tax.
Yes.
But without saying it, I feel like that's what it's saying.
Yeah.
But it would come from the individuals themselves.
Yeah.
Not from like everybody else.
Well, from all residents of Vermont.
No, it
Yeah.
comes from everybody. Oh.
Anybody with a taxable income over 150% of federal poverty.
Yeah.
So that's not good.
Is it limiting? And in your question, is it too limiting for them to offer suggestions on the source of funds? I don't know what other source of funds there would be, but.
Dan made an off the cuff comment, but I won't repeat it on Zoom. Comment. and I agreed with it.
We can do anything with the bill. I
We
mean,
can do anything with the bill.
this-
No, I know that's, I'm just saying, if we're asking for this in a study,
Yeah, other sources.
are we limiting their creativity and suggestions to us?
And that's a good point, because we do spend a lot of money on making sure that these facilities are adequately funded through emergency financial relief, for increases in it's the right word for, yeah, there is federal and
Base
state
rates.
dollars already going. Might it be better if it was a little more organized in terms of it going into an account that can help people who are in need of that skilled nursing care?
So we could put in there already existing funds.
Yeah, I mean,
It could be a combination. It would
right.
have to be a combination.
We're
because
taxing
we're not
people
paying
to
for
death.
this
I mean,
anyway.
Yeah, I mean, we'll have some discussion about this and we may actually have some time to actually, because this is a study, it's not requiring
Right.
any real expenditure of a great deal of funds. And we can have the treasurer weigh in on this because the treasurer actually has some experience. The treasurer's office has experience in both things that are voluntary as well as things that are mandatory, with regard, automatic, that's what I guess, thank you, automatic. And I would imagine we'd hear from the tax department about this as well. Yeah. Go ahead.
So, I mean, there are two potential sources of funding that have existed for decades that have been no end of frustration to me for our failure to take advantage of them. And so I would love to see us look at those. One of them being the loophole that we have in Vermont that only 2 states have that allow people to stash away their money and not have it recoupable for long-term care. And so they therefore end up drawing on Medicaid when they gave away their money somewhere else through a loophole. There are 2 loopholes in Vermont law that other states simply don't have. And the other one, I don't even know if the other one exists anymore, and my memory of it is very foggy, but because this goes back like 20 years when we last worked on a bill on it. And that was the federal, Katie probably will remember this, but it's if you buy long-term care insurance, you get protection of your assets for a certain number of years. And people were really, it didn't move because people were really concerned that that protected the wealthy and got them to keep their assets. And didn't focus on the fact that by doing that, because most people died before that trigger would be set from the long-term care insurance, by doing that, we're preserving a significant amount of money for the people who need to benefit from long-term care coverage under Medicaid. So those are both opportunities to do something that's probably really advances equity in a way that most other states do, and that we have loopholes on before considering you're going into some sort of payroll tax, which I don't know if that does even exist in other states.
It raises a good point that how much money is that is not going into the system of support for those individuals? And what
probably
impact does
don't
that
know.
have on the Vermont taxpayer?
Well, right. And that's the whole point, is the money comes from Vermont taxpayers,
Correct.
Medicaid instead.
Yeah.
And I became very familiar with it when my mom was in the situation of decision-making. And she realized if she moved to New Jersey, where my brother lived, so she had other, she would have to pay long-term care, much earlier out of her, whatever
Right.
assets. Yeah. Whereas if she stayed in Vermont, she had a total loophole to protect those assets. So.
Wonder if we could put language in to look at what impact that would have of eliminating that.
Right, and it's two different,
Right.
then there's also the, if you buy long-term care
Mhm.
insurance, and I don't know if that even still exists. That was because of a federal law, but I don't know that it's changed. It's just,
So, Katie, I'm just thinking about sort of background information that we'll need, because I think we'll probably have some discussion about this bill. If we can consult with your tax colleagues about what might exist for loopholes, so-called loopholes.
those are, it's the revocable,
Exemptions.
it's the revocable trust and the revocable property life estate. Those are the two loophole pieces that other states have closed.
Mhm.
And then the long-term care insurance is something different.
Well, and I think we probably would need to hear from DEVA as well, because they do have a recapture of assets.
Right, but they can't recapture these because we have the
If-
exemption in
If
law.
people have done that, if
Right.
people know enough to do that.
And
right.
people who have more money are more likely to know to do that.
It gives an advantage to people who have more in the way of assets and or education, honestly, to be able to
Have
understand that.
attorneys
And-
and
right,
so forth.
yeah. So we'll need some background information on that. Okay.
And who pays for this study and how much is it?
Well, we haven't gotten that, we haven't gotten that far yet.
Okay.
Anybody else have any other questions for Katie? Right this moment? Okay, great. Thank you. Thanks, Katie. And we've been joined by Representative Iacovone. Welcome, Dave.
Thank you. Thank you for having me.
Of course, of course. I see that the WCAX picked up a nice story on this bill.
It was a,
They call this a healthcare committee, but
well, it was a
yeah, the
slow news day.
part was right, but. It's on WCAX on Monday.
Okay.
So
was it? The most.
Yeah.
I think it's at one of the most, yeah. So welcome Representative Iacovone. So we, the history about this far more than the rest of us. So please enlighten us a little bit about the previous work that's been done on this. I understand that something similar to this passed the House some years ago.
It did.
And then didn't make it through the Senate. But if you wouldn't mind giving us some background about I think that we understand the need for this, but the background about what you're thinking about in this bill in particular, and then anything else that you'd like to share.
Thank you. I'd be glad to, and I want to thank Representative Noyes too, who's a co-sponsor on this and all of his leadership and long time interest in it. So back, I thought it was 1994. I could be wrong on the year. A bill passed the House with 95 votes. So it was up there with a lot of support. And at that time, of course, it was a different era, wasn't it? At that time, the line was for a cost of a pack of cigarettes, $2 a week. Vermonters could get insurance for long-term care when they need it. And it was a bill at that time. There was something called the Healthcare Authority that did the work on this and had an actuary and et cetera. Look at the numbers. It was modeled after Social Security, where everybody paid in a little, but of course that depends on where you sit. There was no cap. So depending on how much a person earned, it was a certain percentage. I don't remember the exact amount, less than 1%. So, if you made $1 million a year, you paid a lot more than somebody making at that time, 10,000 a year. There was, as this proposal suggests, a floor whereby people would not have to contribute. This speaks to 150% of poverty, but that can be adjusted to be as high as 300 or not even one. So the environment at the time, healthcare was being discussed, healthcare without long-term care. And there were a number of us who said, you really can't look at healthcare without looking at long-term care. And sometimes we still have to invoke that message today.
Sometimes, all the time, all the time.
Always.
Representative Tony.
Glad I'm speaking to members of the families.
Yeah.
It impacts acute care, it impacts primary care, et cetera, and that you need to look at them together. So there was a reluctant acknowledgement on the Senate side to do that because they were more totally into traditional healthcare at the time. But it did quite well in the Senate. The vote was 17-12. So I like to say if it had 3 more votes, it would have reached 15. I remember when I went in to testify, because we had spent a lot of time in this committee and all over the House bringing this through the process and Ways and Means, appropriate, et cetera, et cetera. And in the House, when they had their hearing and I sat in the chair, the senator said, you have 3 minutes. So I thought, okay, to myself quickly, I better be brief. That's what you get in front of the Supreme Court. So it also told me how serious they were about whether they were going to look at it or not. But even with that, it did garner, a reasonable amount of support, even though I had been working almost exclusively on the House side and not as I should have been on the Senate side also. So the notion, the industry was the nursing home industry at the time was by and large quite supportive because they understood that the growing demographic, the aging demographics, even in the 90s, early to mid 90s, where they were headed and how could they possibly sustain the level of long-term care services. There was also support from those on what I would say on the home and community-based side, although I believe nursing homes are in that side of the ledger too. Mm-hmm. They're part of our community, an important part. But in any event, they too, because the bill would have supported care in the home also, as this one is intended to also. I would hope it would be designed to do that. So there was quite broad support and that people said, yeah, this makes sense because heaven forbid if I or a loved one in my family should be fallen by some type of disability, illness, et cetera, accident, the cost even then in the 90s would have wiped out a family quite quickly as it does today also. Vermont's so-called spousal impoverishment laws were not as robust as they are today. We have did have some of the best in the nation. So at that time, it truly was, you could argue that you're going to become a pauper if this should happen. And even today, I think you can still argue that because in order, as you all know, I don't need to educate you, but in order to be eligible for Medicaid, you spend down. It doesn't take long at $300 a day, even for the most comfortable among us, to end up on Medicaid's door. So the intent, same arguments then, not arguments, the same rationale, if you will, as I think exists today. We have a Medicaid program that was struggling just to pay providers what providers needed to be paid to attract help at the time, just like today, same thing. How with this aging society, and now it's aging even faster, did we want to, and I'll use the word saddle, we didn't want to saddle our children with the cost of paying for Medicaid with general taxation, take away from children's programs, education, anything, you name it, to pay for this fundamental need, the safety net need. And even more, as you know, with looking at enhanced financial relief, the cost of that, the caseload costs, it's so hard to come up with a state share for Medicaid. And this program has the potential to do both, depending how it's designed. It could help pay with the state match for Medicaid. It could help pay for individuals' care. And I'll just speak to that very, very briefly. Now, if you're in a nursing home, as you all may know, but I don't want to assume anything, patients have what's called an applied income. So the bill may be, could be $3,000 a month, whatever the cost may be. And each of you would have a different applied income based on your social security or other assets. You'd get to keep around $75 a month, give or take, for personal needs, barber, beauty, newspapers, et cetera. That's $75, but the rest you would pay to the nursing homes, your applied share, your applied income, and then Medicaid would pay the balance. This bill could help pay for that applied income share for families, or for those that were eligible, it would pay your social security check, plus if you were eligible for this program. There was a pretty extensive conversation about the eligibility threshold to get into the program. There were some who said nothing. Yeah, if your doctor says you need it, you should go in. And there were others who said, wait a minute, for cost purposes, you need help with at least 3 activities of daily living: feeding, bathing, toileting, dressing, moving from bed to chair, and even instrumental activities of daily living, telephone, check writing, etc. And I'm pretty sure the bill ended up on 2, because at that time, not sure about today, at that time, by and large, in order to be eligible for a nursing home, you needed help with 2 activities of daily living. So the intent was to try to have the eligibility threshold at whatever the practice was. And which I would hope it would be whatever the practice is today. If you need help doing that, you would be eligible. Lots of conversations for those who didn't want it about, well, what if I pay in for 10 years and move away? You're still eligible for your share. It takes some type of, administration to keep track of all that. What if I die? What if I pay in for 10 years and die and never get it? I guess Social Security could be the same way, couldn't it? Although there are survivor benefits, you may not get it. It's an insurance program. And I've always said, in the words of our good friend Deborah Lacey Baker, she said, Dave, we're all tabs. We're all temporarily able-bodied. And this state of wellness we enjoy, some more so than others, is not a permanent condition. Our time will come. For some, it could be soon. For some, it could be very, very long time and a very short duration. But who will be there to help us? Will it be our family? Will it be our friends? Will it be our neighbors? Will it be strangers? Will it be government? Unless we build up the financial capacity to pay for these kind of essential services, we put that at risk. We really do. Either we don't have the capacity to do it, or it's not a quality any of us would want. So in that spirit is why the bill was offered many years ago.
Mhm.
And that's why it's really offered again.
Mhm.
Does that help?
It does. It does help a lot. And, I think about the environment in which we are right now in terms of, obviously, things have changed a bit since, the mid-90s to where we are today. We have Choices for Care, which is it's a Medicaid program still, but we do in the 90s, the only place you could get any long-term care that was paid for was in a nursing home. You didn't have the option of community-based care. And so it was, I'm sure, was pretty groundbreaking discussions that you had back in the 90s when you were working on this. It seems to imply some sort of tax, since it's, references Social Security is an insurance, a mandatory insurance program of sorts. Did you give any thought to something that might be a voluntary? What I'm kind of wondering about is whether we're kind of thinking of maybe a bit too narrow in terms of what might be plausible in a report or a study to come back and to inform us. I'm wondering about whether I guess the creation of state-backed or state-run, but personally financed long-term care insurance, which is sort of similar to this, except for, I'm just wondering about the viability of requiring people to pay in at this point in time.
There were those conversations, but they weren't as sophisticated is the wrong word. They weren't educated by what was available that
Yeah.
much. There was a question of, well, if it's just, a tax on earnings, there are a lot of people with a lot of wealth, but didn't earn them through a payroll.
Yeah,
And you would miss that.
yeah,
And at the time, I can remember several legislators saying, you're missing that. We need to capture that. We didn't have the wherewithal, but I would think now, because this is a study, I would broaden the net. There are other ways to finance this.
right.
Certainly the payroll type way is one, but I think there's other means of capturing wealth than just that traditional way. I worried at the time, I don't mean to digress into paid family leave, but a voluntary program, you get what's called adverse
Yeah.
selection.
Yeah,
And this could have a lot of adverse
It could.
selection and it would go, if it isn't spread broadly, it would cave in, I think, rather quickly.
well, and I do worry about things that are voluntary, so we would have low-income individuals and people with disabilities covered under the state's Medicaid program. And those who could afford to make some contributions, would be covered under this or some other program. And then it's those, the vast majority of us in the middle, who sort of, as you said, might be the folks that the program would cave in on, because they might not necessarily, choose to or might not necessarily understand or choose to make that kind of contribution, on their own. Yeah,
I had suggested, and I still do, I said, folks, you will pay one way or the other.
it is true.
We're a civilized society. We care about our friends and neighbors. We will pay if they start lining up and can't get into the nursing home, or if the home care is not available. You either pay through broad-based general taxes or a diminution of other essential government services. You have to cut somewhere to pay for it. So you can either be upfront about it, pay me now or pay me later. I believe if people pay later, it would be a larger bill.
Uh-huh.
We're seeing that right now.
Yeah, we are. We are. And, I think it certainly in this committee and in your committee, you've seen the impact on long-term care facilities, whether it's residential care or nursing facilities, and the need for greater and greater state contributions. And, it makes me wonder about yes, we need those facilities as part of our continuum of care, for individuals. But I also think about, we've made very sizable state contributions, and those very sizable state contributions could have also helped jumpstart something like this.
Yes, yes, absolutely.
That would have broader impact. So, and there's, when we think about other sources of funds, I think about, the unclaimed property fund, that goes into the general fund now after some certain period of time. I don't know exactly what that is, but, there are other sources of funds out there, that, yes, might be redirected from someplace else. But I think that your comment about, we either pay through some mechanism like this, or we pay through increased Medicaid costs, and being able to be more planful about it might benefit not only individuals but states.
Seems to make good sense to me.
Yeah.
Need to be planful.
Yeah, yeah. Go ahead, Representative Garofano.
Thank you for this information. Are there any other states that have implemented something like this yet?
I haven't looked recently. At the time, I was trying to think if California had, but I'm not aware.
And then just a comment is, this kind of makes me think of some of the work that we did around childcare and the study that we had done that kind of built the framework on what we built so kind of thinking about needs versus utilization. I think one thing that the childcare study was really great at giving us information of what the need was. Based on a lot of data that they collected and analyzed, and then what would it take to meet that need? So just kind of want us to be thoughtful about that is,
Yes.
Understanding what the need is. So whatever the source of income is, we can kind of align it with that and be able to move it up and down based on whatever the need is.
Absolutely.
Yeah, go ahead, Todd.
Yeah, I really appreciate where you're coming from. And money's out there. We just need to start cutting back on programs. We have to put our priorities in the right place. And your program, we're all gonna be there, like you said. And I really appreciate what you said. Thank you.
You're welcome.
Other questions or comments for Representative Yakuboni?
Thank you for considering this. I know there are many things that compete for your time. Just.
Well, as you so aptly pointed out, it'd be better for us to be planning for the future. The future is now, I think understanding that is important, and understanding some of the things that Representative Donahue spoke about in terms of some of the loopholes that the state has. And, we talk about people not retiring here, but some of those loopholes are probably exactly why people are retiring here. So thank you so much.
Thank you. I bumped into a longtime lobbyist who said, I was here back in the 90s. It was a good idea then, and it's a good idea now.
Yeah,
And I thought if only we had started, we'd be
in the 90s, right? Where would we be now, right?
Where would we be now?
I know.
Thank you very much.
Thank you for your
Thank
thank you for your forethought and your perseverance. Appreciate that.
Be well now.
Okay, you as well. Okay, so we have a bit of time between now and 10:30 when our next witness is here. H36 is going to be S36, sorry, it's H46. S36 will on the floor tomorrow. It was voted out of appropriations yesterday. I do expect to vote on H248 either later today or potentially tomorrow morning. So that's depending upon the testimony that we get, and then another look at the bill. It's been a few days since we've taken a look at the bill. It's a fairly straightforward bill. Just to be aware of that.
I know who's reporting that.
We don't yet. Is that on your list? Who volunteered? No one voted. No one volunteered for H248. So be thinking about if anybody wants to do that. And then the other thing, just to give you a heads up, we are going to be on Friday made some assignments about looking at the reports. So we are going to have some time tomorrow and on Friday to hear what you have discovered in your review of your assignments. Okay, so be prepared. And just to remind you, we're also talking about whether we should continue that report, whether it was a one-time report, or if there's any potential changes that we might be looking for in how that report is structured. I do want to follow up on our testimony from Reach Ahead on the Reach Ahead pilot that we had last week. We had asked for information from DCF. I asked again, as you heard yesterday, and I have asked again today in writing. We have yet to receive that information. Just to be clear, why we are seeking that information is because there appears to be money that was intended for these beneficiaries that will not be spent. Yet we have people who have not had the benefit of all of their benefits under this program. And so to me, it doesn't make sense that you just, stop when we have people who have were determined to be eligible, were enrolled, and we say, okay, now you don't get your other two payments. That especially when there's money there, that doesn't make sense. And we were told that the money would just essentially go to the bottom line. It's
Reneging on it.
it's reneging on
I agree.
on a commitment,
Yeah.
made to the families. So that's not, I don't feel good about that, and so we're going to pursue that. Any other questions or updates that we have? H91 is not on the agenda today in health and welfare. It is tomorrow. They're going to start markup tomorrow. They've worked their way through the bill. We've been having some ongoing conversations about that. Yes, Todd.
I won't be here this afternoon. So we're voting on 248 in committee.
Yes.
Can I submit my vote now or?
Not yet, but you can call in and use one of your remote votes if you would like.
Okay, I would. Thank
You
you.
do that?
Yeah, I'll
Okay.
do that.
Like I said, it might be this afternoon or it could be tomorrow morning. But if we vote on it this afternoon, I will make sure that we call you for your, or are you going to be able to Zoom in this afternoon or?
Yeah, possibly.
Possibly, okay. Even if it's by phone, you can do it by phone. It doesn't have to be with the computer.
Okay, good. Thank you.
Okay. And then tomorrow morning, we are hearing from some members of the Vermont State Employees Association regarding their experiences at DCF. We don't have a full list of witnesses yet, but we have some folks who have requested to testify. And it's really kind of a follow-up. We had started to receive some requests to testify last session, and we ran out of time to do that. Also, FYI, I have a service to attend tomorrow afternoon, so I won't be here tomorrow afternoon. And you may have tomorrow afternoon to work on constituent services.
That's another thing. I got a message. Somebody asked me where the restaurant program EBT card use.
Oh, the restaurant meals program?
Yes, that was it.
Good
They just said.
question. I think
I can
they're
read
trying to
it.
work on language in the Senate, but I don't know when. I don't,
I can ask Senator Hardy.
yeah.
She.
I can read the question. And that way we can answer it on camera and they can look themselves. Okay, ready? I said I'll follow up. So here's my follow-up. Brenda, on February 6th, the committee heard testimony on Hunger Free Vermont wanting to expand SNAP benefits to allow homeless, disabled to buy meals in restaurants. Where did this bill go? Or what became of this bill?
Right, we have, what's the bill number up there? H-151. Okay, so we have not taken up H-151. There was some move among advocates to try to have language put in the budget. I don't know where that's at right now, to be perfectly honest. But H-151 is still on our board, and that, we will have time in this session, if that's a bill that people want to take more testimony on. We certainly can. We did hear from the department that it does have a cost to implement. So we were not, honestly looking at things that had any kind of significant cost to implement. So it is, I'm not going to say it's not going to happen this year, but I think it's unlikely if you want to.
And I still want to express, I think it's more expensive than allowing people to use their EBT cards to be able to buy prepared foods at their grocery store when they're getting groceries and be able to buy a hot meal, a rotisserie chicken or a birthday cake or.
That you have to take up with the feds.
That's the
it's a
federal
law.
Okay. Okay.
We cannot.
I always
change.
wondered
So
why.
this is kind of something we can do that would allow folks who are unable to prepare their own
So
meals.
that's why, because it's
Yeah.
federal, because
Yeah.
it would be so much less expensive and people would be able to
Understood.
budget better.
Yeah, understood.
Okay, now I get it.
Okay.
Okay, thank you.
And so, so you have the information you need to get back to your constituents.
Well, I'm gonna have them watch the video.
Yeah.
So I got the information and I'll share that it's on Lightscreen.
Okay.
Thank you.
You're welcome. Okay, anybody else have any other questions about, pending activity for the committee? The floor, I just, so people know a little bit about like what happens towards the end of the session.
yeah.
What's happening now is a bit unusual. And we are usually at this time spending more time on the floor. But there are far fewer bills, one that came over from the Senate, and fewer bills that are being acted upon this year. And so, while ever since I've been here, I don't know about Ann, but ever since I've been here, at this point in time, we rarely had afternoon sessions, in committee. And so,
And often, you know, in 5, 6, 7
Yeah.
in the evening.
and so, sometimes we had, right, sometimes we had a dinner break and came back after dinner. So, so we're trying to modify our schedule somewhat and figure out, what we're going to do. So we're probably going to take more testimony on 120 than we probably would have. And talk to the treasurer about what it might take to prepare a study. It says the administration, but I think it's more aptly put in the treasurer's office, to be honest. I think they're more, I think it follows in their expertise more. Yeah.
One thing I would be interested in hearing more about, maybe not necessarily this week, but the week after, if we have time, is we had a hearing with healthcare on potential changes in Medicaid, and I would be interested in any updates that CMS has heard. You know,
Yes.
just keeping an eye on what's going on. I've been trying to watch, but it would be helpful to have somebody who's, you know, in the thick of it come in and kind of update. And I don't know if this is
We
the,
tried that, just so you know.
Okay.
And they've declined to, they said, we don't have any more information that we've already
which
shared with you.
is probably the case. I just,
Uh,
I've been seeing stuff coming out in
Yeah.
media, and I'd be interested.
yeah,
And like I said,
You
maybe
can get
2,
more
3
off
weeks from now.
Facebook than.
Yeah, whether it's true or not.
Exactly.
that, right.
Exactly.
So certainly, when we get towards the middle of May.
Yeah.
When the feds need to take some definitive action. I mean, all we're seeing right now is a lot of,
Correct.
you know, reports about what they think might happen. And, so, you know, just so people know, I have tried that and they said we don't have anything
Thank you.
more to report. So,
Why, excuse me, why, you just stated that the feds will need to take more action in May. Why in May?
because there's budget action that needs to be taken at the
I see.
federal level in May.
Okay, so
Continuing resolution only goes till May,
I see.
middle of May.
I see.
So they have to take some action.
Mhm.
You know, you can Google what the current proposals are on Medicaid right now. It's around additional work requirements. There was what we call an expansion population that they're talking about narrowing. There was more things like documenting of disability. There's several things. If you go to the NCSL website, there's several articles in there.
I was
About,
looking yesterday.
yeah,
Oh,
it's you know, we are, you know, there appears to be some pushback happening. You know, who knows? None of us are going to be able to predict it, I don't think. We'll have to wait and see what happens. That's why mid-May is a important
Yeah.
time to see what's going to end up being acted upon.
Just appreciate it being on the radar, so.
Yeah, we are continually doing that. And, you know, one of the things I heard from other colleagues is I don't know what constituent information you're providing, but it is helpful for people to know that, you know, we are tracking these things, even though we're not able to give them any definitive answers at this point in time. You know, for instance, I have I have shared the sort of spreadsheet that we got from DEVA when we had the joint hearings of people who are really interested in Medicaid, who have some background knowledge. You probably just wouldn't share that as a general thing, but as what, as well as the things that I posted in my Front Porch Forum post this week about the Rare Disease Advisory Committee and the growing importance of that, particularly with the elimination at the federal level of that advisory committee that informs the states about what we should be screening for in newborns. So I think that, all of this kind of stuff, there's ample information out there about things that are happening. Jubilee is taking the lead on collecting information from our community partners. We heard around, because the Appropriations Committee is taking it from state departments. So wanting to know what grants, and they also said that we are welcome to sit in on their committee hearings. If you want to look at their agenda to see what departments they're hearing from, if you have a particular interest, you can go downstairs and sit in on that if we don't have anything scheduled here. Jubilee is taking the lead on getting information from our community partners. So I'll just give you an example. The not long-term care, but that's probably going to be impacted as well. The healthcare ombudsman, that's Mike Fisher, who he and the folks in his staff, who, when we have constituent concerns about something happening in healthcare, they are the go-to people, and they have helped countless numbers of people to get through insurance questions, to get through Medicaid questions, to help people with eligibility, to help them understand what, some notice that they've received. It really, anything, they've been an invaluable resource, and their federal funding is slated to be eliminated, and that by October 1st, and that is 2/3 of their funding. So that would mean a very significant rollback in whatever services that they have. So those are the kinds of things that are cropping up as more and more as we hear things. Yeah.
And I just caught up with reading I think it was a Digger article from a couple of weeks ago, but the house in Randolph that I was working on for Habitat when I fell and broke my leg, they were expecting to do the kind of final big push to complete it with a team of AmeriCorps volunteers who have been canceled.
Yeah.
So, that's going to be a big delay because local volunteers are sort of fits and starts and then fall off ladders and can't continue volunteering.
For Vermont, I worked with lots of that is how we often get youth moving into Vermont through their AmeriCorps, and then they end up staying here. And so that is going to be kind of a huge loss to our state, just doing the important work they're doing. But it's often how we get young workers, New Vermont,
Yeah.
And that's a duplex that would be two more
Housing
families,
units.
housing units, low income housing.
It really is a shame to see what's happening in the AmeriCorps. I serve on the Vermont Commission on National Community Service that kind of oversees the grants, and it's very concerning
Yeah.
across the whole country, not just Vermont.
No, it's massive changes for sure. Okay, so we will, Lori, go off live now, and we will see you back here at 10:30 when we have our witnesses